Come in. Hi, Carl. Come and have a seat. So, Carl, what can I do for you?
I've been getting these headaches and I can't think straight.
Okay. Have you got any ideas what might be causing the headaches?
I don't know.
How long have they been going on for?
For a while. I can't remember.
Have you been sick with the headaches?
Not really, no.
Are they on one side of your head or both sides of your head? Don't worry, don't worry. Is there one particular time of the day when you tend to get these headaches?
Sometimes when I'm at work. I'm fed up with work, you know. It's full of idiots.
Full of idiots?
They keep on laughing at me when they're all idiots.
How long have you felt like this?
I can't remember when it started.
Have you noticed any other changes?
We can see that Carl is experiencing some level of psychological distress, but again, he's unlikely to reveal the extent of his problems without the GP asking those vital probing questions.
Have you noticed any other changes?
This one guy keeps staring at me like he's trying to freak me out or something. You know, I think he's put them up to it, you know. I don't really want to talk about it.
Okay, but do you think your headaches are probably caused by your problems at work?
Yeah. He keeps pushing, like he's pushing inside my head. He's stopping me from thinking.
Is he affecting your thinking in any other way?
My thinking's not affected. I just want some peace, that's all. They're all idiots.
Here, Carl is showing some signs of loss of concentration, irritability and delusional mood. In such cases, it's vital to maintain a watching brief.
Okay, Carl. Well, I'm not quite sure what's causing your headaches, but I'd like to see you again in about a week just to see how you're going. So what we need to do now is go out to the reception and get an appointment. I'll come out with you and we'll have a chat with the girls. Okay? You gonna come?
There are several probing questions to ask when an underlying psychosis is suspected, or if the patient is showing signs of mental distress. These can be broken down into 3 categories. First of all, there may be changes in behaviour. A probing question might be, do you tend to spend more time on your own recently, or less time with family or friends? Secondly, changes in thinking. A probing question might be, have you found it hard to concentrate on whatever you're trying to do, such as reading, and do you find yourself becoming easily distracted? Thirdly, changes in mood. A probing question might be, have you found yourself getting low or depressed recently? Is this a change from how you used to be? Many more examples of probing questions can be found in the accompanying booklet.
So what are the treatment options if you think that somebody is vulnerable to developing psychosis?
Well, this is a vital point. I think there's often an argument that we should wait and see if the psychosis emerges. But a delay in engaging a vulnerable young person can make it much more difficult to do so later on when insight's lost. And this can lead to much heavier use of services and also relapse. Young people with psychosis will usually be living with or in high contact with their families, and they're the ones who will be aware of all the changes. It's vital that the family is engaged early, both to get a full picture of the emerging psychosis and also to engage the patient in treatment. We'll see an example of this in the next scene.